Bismillah ar-Rahman ar-Rahim. Today I will speak about another important clinical skill. As I mentioned in my last episode or presentation about I'm still talking in the series of clinical practice lectures and focusing on the clinical skills. And I'm still talking about the general clinical skills. Last time I talked about listening as an important general clinical skill. And as I promised you that I will talk about this time or next time I will talk about, which is now, I will talk about thinking as a skill. And then we shift to the third general important one, which is observation. So today, our point of interest and focus is thinking in clinical practice. In fact, thinking is the most important clinical skill, which we need it in all steps or in all phases of the clinical management of a case or a patient. Starting with the history taking and then in the physical examination and then asking for the clinical investigations needed for that case and in the interpretation of the clinical investigation results to reach to a conclusion or problem solving. So thinking is needed in all steps of the clinical management process. That's why it's very, very important. Actually, we all know that the most important organ in the body to survive is the heart. And the most important organ to survive functional and productive in your life and in your society and community is the brain. And the most important part of the brain is the cerebral cortex anatomically, in which there is the mind. It is in the cortex and its related centers below the cerebral cortex, the gray matter and in the white matter, the different centers and regions in the brain which actually play an important role in the thinking process. But it is mainly in the cerebral cortex, the highest part of the brain anatomically in the cerebral hemispheres. So the biggest God's gift to human is the mind. And the most important function of the mind is thinking. And the best exercise of the mind is thinking. Same like physical activity is the best exercise for the body. The best exercise for the brain is thinking. And it is the most important function of the mind. The most important function of the brain is to think. Because without thinking, you can't manage your life. And if thinking is disturbed, everything is disturbed in your life and everything comes wrong. So thinking is the most important brain function. And the most important part of thinking is what we call reasoning. And here I will stop to talk about this issue. What is reasoning? Reasoning, أو تسبيب باللغة العربية, in Arabic, تسبيب. So the ability to make, to be able to make a reasoning is the most important part of thinking. Actually, and it is a skill by itself. This is what we call the reasoning skill. So reasoning or thinking skills is almost the same. Reasoning skills is actually refers to what we call critical thinking skills, which include analysis, evaluation, and synthesis. But it also involves a wider range of skills, including what we call the abstractive thinking, creative thinking أو التفكير الخلقي والإبداعي, analytical thinking التفكير التحليلي, and problem solving and information processing. So these are the components of what we call the reasoning skills. Actually, reasoning also has many types. It includes what we call the inductive reasoning, the deductive reasoning, the critical thinking, intuition, and other types of thinking like the decompositional thinking, the cause and effect thinking, the analogical thinking, and the abductive thinking. But the basic or abductive reasoning, but the basic important two reasoning types is the deductive and the inductive reasoning. So whatever the type of reasoning, or regardless, all the aim of all types of reasoning is that the person will be able to reach to a conclusion or to a problem solution in a correct way, to reach to a correct decision and a correct conclusion about your case. Because if you don't have the ability of reasoning or the reasoning skill, you will not be able to reach to a correct clinical conclusion or clinical decision. So it's a very important for the clinical decision making. And here we come to what we call the logic. Actually, the logic or reasoning, they are almost the same. So to say logical thinking or logical reasoning is almost the same. It's the same. To be able to think logically, to be able to put your diagnosis on a logical background, and this is what we call diagnostic reasoning. Diagnostic reasoning. Almost the same to say diagnostic reasoning or clinical reasoning. It means that your clinical decision is having reason. It is based on reasoning, that you analyzed well, you evaluated well, you interpreted well, and so in a systematic way, according to certain mental calculations and rational interpretations, mental calculations and rational interpretations, so that you have reached to the correct conclusion and the most probable correct diagnosis. So this is what we call the reasoning. The logic, or what we call the clinical logic, is pivotal here. And by being logical in your reasoning or in your thinking, this means that the doctor or the physician or the person is able to interpret and evaluate or think in a disciplined manner. When you are able, it is an ability. The logic is a mental ability. It is a mental ability. It is a mental skill. According to this ability or this skill, the person or the individual is able to think or to interpret and evaluate in a disciplined manner, or base his thinking or base his or her thoughts as a clinician on facts and on evidence. So that at the end you will incorporate this logic into the thinking process and put it in a systematic way of steps, so that this systematic way of steps based on or collectively are put in the framework of what we call mental calculations and rational interpretations in your mind, which I mentioned the highest part of the brain, which is responsible for this thinking and reasoning process, to reach to the conclusion. And this is actually in not only in medicine, also the judge in the court. The judge in the court uses his reasoning, and any judgment should have what we call reasoning, تسبيب الحكم, تسبيب الدecision, the reason of your decision, the reason of your judgment, because the clinical decision is a medical judgment. It is like the judgment of the judge in the court, but the judge in the court gives a legal judgment, but the doctor gives a medical judgment or a clinical decision. But the basis is the same. Both the judge and the doctor, the physician or the surgeon, should use what we call the logical thinking or logical reasoning, or use the reasoning skills in his practice to reach to a correct conclusion and a correct decision, so that he will have a successful management, clinical management. So this is very important. As I mentioned, the logic is the ability of an individual to think or to interpret and evaluate in a disciplined manner, or base his thoughts on facts and evidence. And this is what we call the use of evidence-based medicine, or the use of the guidelines, the clinical guidelines, which are put by the responsible scientific facilities and organizations in different medical schools and in different medical authorities in the world, although they are different from part to part in the world. But these guidelines, which are evidence-based, because they are evidence-based, they can be used, and they should be used by the clinician for reasoning and to take the proper clinical decision. What is your evidence-based? What is your evidence-based? What are the guidelines which you followed in order to decide about this case regarding diagnosis or choosing the therapeutic options or treatment of the patient? So this is very important to know, the logic. So accordingly, the using these skills is very important. And as I mentioned, thinking includes actually many mental phenomena like focusing, connecting, analyzing, generating, and completing, and organizing. These are different processes in the thinking, or different fractions in the thinking as a process carried out by the cerebral cortex and the interconnected related centers and regions in the highest part of the brain, as I mentioned. So this is very important to know. Here and then I will shift to another issue, which is, as I mentioned, the critical thinking skills. I mentioned reasoning. Reasoning is actually the most important critical thinking skill. And I mentioned that it includes analyzing and this is what we call analytical thinking, analyzing the situation, analyzing the case to reach to a proper diagnosis, evaluating and decision making and problem solving. These are all fall under the main heading of what we call the critical thinking skills. So then I will, and then as I mentioned, the logic is related to reasoning. So the logic, what we call the clinical logic or المنطق الإكلينيكي, logic, reasoning and thinking are almost the same triangle. I put them in a triangle. The thinking, logic, and reasoning. Thinking, logic, and reasoning. So your thinking should be logical and should be reasoning, should be reasoned. So there, and this is what we call the logical thinking or logical reasoning. Logical thing. The one which collects them together is the use of logic in the thinking process. And then this is very important, because the logic will teach you or teach any human to make a distinction between what is right and what is wrong. If your logic is not proper or is disturbed or not based on evidence and facts, so the conclusion is never correct, and the decision making or the decision, your final decision, is never correct. It will be wrong. The proper use of logic will teach you how to make a distinction between correct and a non-correct or wrong decision or solution for your problem, whether you consider it problem solving or you consider it a clinical decision. That's why also logic is very important in, for example, of course, in a science like mathematics. In mathematics teach you how to use logic. If you don't use logic in mathematics, that's why, number one, if you can't use logic in mathematics, you will not be able to solve the problem in algebra, in geometry, and if you are not clever in using logic in mathematics, you will not be able to use logic as a philosopher or as a doctor or as and that's why the issue of logic and the philosophy of medicine and the philosophy and mathematics and these things are interrelated. A good mathematician is a preparation to be a good philosopher. The one who is very good in mathematics will be very good as a doctor, will be very good as a philosopher, will be very good as a thinker, because mathematics teach us how to think, how to be logical. And then I'll come back to the my point as a clinical practitioner. The use of logic is very important. As I mentioned, it is ability to interpret and evaluate, as I mentioned, and the logic should be incorporated into one's thinking process, as I mentioned. لازم تدخل المنطق في أي عملية تفكير. ما فيش فكر من غير استخدام المنطق. هنا you cannot think without being logic. If you don't use logic, your thinking will not be proper at all. It will be deviant from the truth, and it will be apart from being correct. And here we say that the logical thinking is very important skill. You must have, the clinician must have